Hi guys, welcome to my YouTube channel Share and Learn. In this video, we are going to decide whether histamine is our friend or our enemy. We know that histamine plays a big role in producing all the irritable symptoms of allergic reactions, such as rashes, itching, runny nose, watery eyes, redness, sneezing, etc. So can we say it is our enemy? Histamines are autocoids. So first, let us learn what are autocoids. Autocoids come from Greek word autos meaning self, ekos meaning healing substance or remedy. Therefore, autocoids are healing substances produced by the body to protect itself. As they have intense but local immunological activity at the site where they are released, they are also called local hormones. But unlike hormones, they are not produced by specific cells and they are not transported through circulation to act on distant target tissues. Depending upon chemical moiety, autocoids are classified into three categories. Amine autocoids like histamine and 5-hydroxytryptamine, lipid-derived autocoids like prostaglandins, leukotrienes, platelet activating factor, and peptide autocoids like plasma kinins and angiotensin. In this video, we will discuss histamine in detail. Histos means tissue. Therefore, histamine is also known as tissue amine, which is beta-imidazolylethylamine derivative. It is secreted by one type of cells in the body and act on another type of cells. It was first studied by Dale and he observed its effects to be similar as that of allergic reactions. Therefore, it is implicated as chemical mediator of inflammation in response to tissue injury and hypersensitivity reactions towards an allergen. It is involved in gastric secretions from parietal cells and they also have limited neurotransmitter role in the brain. Now let us learn about the synthesis, storage, release and receptors of histamines. Histamine is beta-imidazolylethylamine derivative which is synthesized by the decarboxylation of amino acid histidine. After its synthesis, most of the histamine is stored in storage granules within the mast cells, where the positively charged histamine is held by negatively charged heparin or acidic protein. The rest of the produced histamine, which is also known as non-mast cell histamine, is stored within cells called histaminocytes. Release occurs in response to tissue injury, which may be because of excessive cold or heat, toxins, microbial organisms, insect bites, etc., or may be in response to an allergen. Finally, after exocytosis, histamine, which is bounded with heparin or protein, is released into the extracellular fluid. Now, sodium ions which are present in the extracellular fluid gets exchanged with histamine to release it free. This release can be inhibited by beta-adrenergic agonists or methylxanthins, which increase the intracellular cyclic AMP. The released and free histamine binds to histaminergic receptors to produce its pharmacological actions. H1, H2, H3, H4 are the four histaminergic receptors, out of which we will discuss H1 and H2 in detail as they are of clinical importance. Before discussing the actions of histamine, let's check its presence in the body. First, talking about mast cell histamine, which is present in tissues including the skin, lungs, gastric and intestinal mucosa, liver, and the placenta. The non-mast cell histamine is present in tissues such as the brain, epidermis, gastric mucosa, and other growing regions. When histamine binds to its receptors, pharmacological responses can be observed depending upon the type of receptor predominant in that area. So let's discuss its actions on H1 receptors first. When histamine binds to H1 receptors in peripheral sensory nerve endings, it causes itching sensation, and if its concentration is very high, it can also lead to pain. Contraction in intestinal smooth muscles is observed, which can also lead to abdominal cramps. In lungs, contraction of pulmonary smooth muscles precipitate bronchoconstriction and decreased lung capacity. There is increased mucus production in bronchial and nasal regions, leading to rhinorrhea, and coughing is maybe to get rid of mucus from the respiratory tract. The combined effects of H1 and H2 can be observed on cardiovascular system. Vasodilation is partly because of EDRF, that is endothelium dependent relaxing factor, and also there is direct vasodilation of arterioles, which reduces total peripheral resistance, and hence there is fall in blood pressure. This fall in blood pressure generates a reflex response, and also there is direct action on the heart. So there will be increased heart rate, positive inotropic effect, and positive chronotropic effect. Therefore, there is reflex tachycardia. Effects on the skin, that is dermatological effects, can be observed, which include triple response. This is because of vasodilation and increased permeability of capillary. The endothelial cells, they get separated, which increases the permeability of capillary, and there is exudation of plasma in the surrounding tissue. The triple response includes reddening of the skin, which is because of collection of blood as a result of vasodilation, wheal formation, that is small bumps are formed, which is because of exudation of fluid from capillaries, and flare, that is redness in the surrounding area. H2 receptors are mainly involved in increasing gastric secretion from parietal cells. Till now, we discussed actions of histamine by which we can answer that histamine can be our friend. But now we are going to discuss why it is also our enemy. So let's know about the pathophysiological role of histamine in various disorders. In gastric secretion, among three secretagogues which are involved in gastric secretion, namely histamine, acetylcholine, and gastrin, histamine is the dominant one. We know that histamine is present in gastric mucosa stored within mast cells and histaminocytes, which lie in close proximity to parietal cells. Now, when there is a stimulus such as feeding, vagal stimulation, cholinergic drugs, or gastrin, histamine is released from these cells, which acts on the H2 receptors present on the surface of parietal cells and activates proton pump. Therefore, there is increased secretion of H-positive ions leading to enhanced HCl production, which is the main cause of peptic ulcers. Histamine finds its role in allergic phenomena, inflammation, and anaphylaxis. Antigen-antibody complex is formed, resulting in the production of specific reagenic antibody (IgE), which binds to Fc epsilon receptor 1 on the surface of mast cells. This leads to the activation of tyrosine protein kinase and phosphorylation of phospholipase C. As a result, phosphatidyl inositol bisphosphate is converted to inositol triphosphate, which triggers the intracellular release of calcium ions. These calcium ions induce fusion of storage granules with plasma membrane, resulting in exocytosis and release of histamine. When this release is at very large scale, it causes anaphylactic shock. So basically, anaphylactic shock is allergic response at a larger scale. In this situation, there is marked hypotension, bronchoconstriction, and swelling all over the body. This can be treated with the help of epinephrine. Epinephrine doesn't inhibit histamine binding, but it counteracts the effects. So the vasoconstriction brings back the blood pressure, and bronchodilation improves breathing. This can also be controlled by the use of antihistaminics, which we will discuss in the further lecture. Non-mast cell histamine present in the brain maintains wakefulness and alertness of the individual. It is also observed that H1 agonism suppresses appetite. It may also be involved in regulation of body temperature, thirst, and other cardiovascular functions. The agents which competitively block histaminergic receptors and block the actions of histamine are called antihistaminics. They are grouped as first generation and second generation histamine antagonists. Drugs such as diphenhydramine, promethazine, phenyramine, chlorpheniramine are in the category of first generation or conventional histamine antagonists. They are further classified on the basis of the extent of sedation they produce into highly sedative, moderately sedative, and mild sedative first generation histamine antagonists. Second generation histamine antagonists are preferred now as they do not have CNS effects and other side effects of conventional antihistaminics. Drugs such as fexofenadine, loratadine, cetirizine, levocetirizine, etc. belong in this category. Now let's see what pharmacological actions are produced by antihistamines on the body. There will be antagonism of histamine. So all the actions of histamine will be counteracted. Histamine-induced bronchoconstriction will be blocked. Relaxation of smooth muscles will be there, which otherwise were contracted by histamine. Inhibition of triple response. Histamine-induced fall in blood pressure will be counteracted, and the gastric secretions are decreased. As the main mediator of allergic reactions is inhibited, therefore there will be anti-allergic actions. Hypersensitivity reactions which occur because of histamine are blocked. Also, the fall in blood pressure which occurs in anaphylaxis is decreased. Although it depends upon the ability of the drug to penetrate blood-brain barrier and its affinity for central H1 receptors. but the drugs which cross the blood-brain barrier produce marked depressive effects on the central nervous system. There is sedation, which depends upon person to person. Decreased motion sickness is because of inhibition of histamine in the brain and antimuscarinic action. Drugs such as promethazine are also used to control vomiting in pregnant women. They are also used to decrease tremors, rigidity, siluria in case of Parkinsonism. Many H1 blockers such as promethazine, diphenhydramine, phenyramine, etc. have additional antimuscarinic actions. So all the muscarinic actions such as defecation, urination, bradycardia, etc., which we discussed in cholinergic system will be blocked. Many drugs have local anesthetic actions. However, they cannot be used clinically as they produce irritation when injected subcutaneously. Intravenous injection of antihistaminics cause fall in blood pressure as they directly relax the smooth muscles. But this effect is not observed when given orally. Antihistaminics have several uses on the basis of their ability to block endogenous histamine, as well as their sedative and anticholinergic properties. Their major use is in case of allergic disorders. They are also used as an antipruritic drug in case of itching. They are commonly used in case of motion sickness, vertigo, common cold, cough, Parkinsonism, as sedative hypnotic and anxiolytic. H2 antagonists such as ranitidine are commonly used to cure peptic ulcers. The first generation or the conventional histamine antagonists produce mild but frequent side effects. They are known to cause sedation, diminished alertness, motor incoordination, because of which driving is prohibited when you are taking antihistaminics. They can also produce alcohol synergism, and they may interfere in learning processes in children. They commonly produce anticholinergic side effects such as dry mouth, urinary retention, blurred vision, etc. I hope you have a better insight into this topic now. If you do so, like and share this video and subscribe to my channel. If you have any queries, message me in the comment section below. See you in the next video. Bye bye.